1, 2, 3. Roll out the barrel. We'll have a barrel of fun. Roll out the barrel.
Improving a person's physical and mental health, general well-being, independence and the ability to carry out activities that are important to them will help an older person get the most out of their life. People should stay as active and mobile as possible. This will reduce their risk of falls. Many of us will have experienced a fall at some point in our lives. This can be both painful and frightening. For those older people living in a care home, this may happen more commonly, with up to half the people falling each year. A fall is worrying for the person who has fallen, their family and care home staff. It can lead to significant injuries and fear of a further fall. This can reduce quality of life and increase a person's care needs. A hip fracture is the most serious fracture that an older person can have, and many never fully recover from this. There are a number of things that can make an older person more at risk of falling. This DVD will be helpful in highlighting to all care home staff the importance of falls prevention and management. It supports training and education in relation to good practice. It assists continuing and career development, and most importantly, improves quality of care. Everything that is shown in this DVD can be found in the Good Practice Self-Assessment Resource for Care Homes for Older People. This DVD will show you how you can check an older person's health so that you are able to identify risk factors, which are features that can contribute to a fall and help you to manage falls.
Remember, I'll get tight round your arm.
Falls prevention in this environment is not easy, and it takes a team effort. Falls do not happen to people just because they are older. There are factors that will make some people more at risk of falling than others, and many falls are preventable. Supporting documentation. Your care home should have written guidance on all aspects relating to falls prevention and also bone health. This should include, for example, written guidance on falls prevention, on the safe and appropriate use of equipment, including bed rails, how to record falls and maintain good health, falls and fracture risk assessment and care planning. There are general measures you can take to reduce risk of falling and harm from falls for people living in a care home. However, you must also consider each person's individual risk. Assessing a person's risk of falls and fractures, followed by personal care planning to manage this risk, is key to fall and fracture prevention and management in a care home.
It happened that quick, I couldn't really say it was a...
It also contributes to a person's general well-being and quality of life.
A fall is nearly always due to the presence of one or more risk factors. Recognising, then removing or altering an individual's risk factors can prevent falls. Often an older person will have a combination of risk factors. The more risk factors present, the greater the risk of falls. Risk factors can relate to the individual, such as their eyesight or their mobility, or can relate to the surrounding environment, such as the lighting or the floor covering.
A multifactorial falls risk assessment will consider all main risk factors when you assess the individual. In addition, it will consider the person's bone health. If there is a weakness of bones present, such as osteoporosis, the person is more likely to break a bone if they fall. For this reason, you need to consider falls and bone health together.
John, do you need any help in the mornings?
Well, for getting up in the morning. And getting the cream and that on before I get dressed.
And washing?
Washing.
Yeah. And what about getting to the toilet in the morning?
occasionally.
Multifactorial falls risk assessment and action plan. People are particularly at risk from falls and fractures in the first few months of living in a care home. This is likely to be due to their change of surroundings or possibly a time of ill health before they came to live in the care home.
Alright.
I'm fine now.
It is therefore essential that you assess an individual's risk of falling and put a plan of care to manage risk into practice as soon as possible. Each person requires a multifactorial falls risk assessment to be completed.
Hello, Richard. Welcome to Joanga's Care Home. I'm Michelle. I'll be one of the carer here in Buplu. Michelle, you can call me Lulu.
A record of the person's falls history should also be taken. How many falls the person has had, what were the circumstances and consequences of the fall.
When you've assessed risk, you can complete a personalised care plan to inform all staff of the risks that have been identified and the actions that are required to reduce risk. The care plan will state clearly all the measures that the care home team and the wider multidisciplinary team need to take.
It is good if my family and I can talk about my care plan. My family needs to know about my falls, risks, and have a copy of my care plan.
Each person must have a multifactorial falls risk assessment to identify what makes that person at risk of a fall or fracture. The care home team needs to know what action should be taken to reduce the falls risk for each person.
Actions triggered by a fall. Falls pathway. Your care home should have a pathway or have written guidance on what action to take in the event of a fall. For example, a pathway for managing a person who has fallen. This should include a review of possible reasons for the fall, an update of the person's multifactorial falls risk assessment and care plan, and an environmental check of the site of the fall. If you don't know where this information is kept, please ask and find out. Recording and reporting falls. Would you know what to do now? If an individual does have a fall, your team must know what immediate action to take, which is usually to call for assistance and alert a senior member of staff. You will also need to follow your care home's moving and handling guidelines.
Help!
If the person has been injured, you may wish to contact their GP.
Can you give me a hand?
If the person requires immediate medical attention, call an ambulance. The fall must be recorded using your accident or incident reporting system. Falls and fracture prevention actions.
If I do have a fall, you must look at my falls risk assessment again, in case anything has changed. I might need a different care plan.
Risk factors and actions to take.
It is rarely just one thing that will make me fall. The more risk factors I have, the more chance I have of falling. Some things that make me fall are to do with me, and some things to do with the area round about me.
Risks relating to the individual include previous falls, ageing, causing changes to the body, certain medical conditions, being less physically active, side effects of some medications.
Please think about the following risks that might make me have a fall.
Mobility.
If a person has difficulty with walking, is unsteady, has poor balance or weak muscles, then they may require more supervision or assistance with walking. If a person's mobility changes, then they may benefit from a physiotherapy assessment. What I'd like you to do is, can you go onto your toes 5 times? Balance and muscle strengthening exercises can reduce the risk of falling. Consider referring to a physiotherapist and assist the individual to complete any exercise programme as prescribed. Staff can encourage individuals with regular exercise, keeping physically active and mobile.
Do you need leg, Martin? Yes. That leg as well? Yes.
If a person needs to use a walking aid, check that it is always near them and well maintained. Check that the rubber ferrules are not worn. Also check that wheelchairs are well maintained, including brakes and footrests. Do not leave individuals with poor mobility who you know do not ask for assistance unattended on commodes, toilets, in baths or showers.
Medical history.
The person's previous medical history may also contribute to the increased risk of falls. Conditions such as stroke, Parkinson's disease, arthritis, epilepsy, blackouts, high blood pressure and low blood pressure may all contribute to the increased risk of falls.
Medication.
Medications can also significantly increase the risk of a patient falling. A person who takes more than 4 different types of medication has a significantly increased risk of falling. Medications such as psychotropics, anxiolytics, antidepressants, sedatives, diuretics, medications that slow the heart down, blood pressure tablets, and many more can be associated with an increased risk of falls.
Look out for medication that may cause confusion, dizziness, unsteadiness, drowsiness, or lower the blood pressure. The yearly medication review may be the opportunity to look at medications which may be increasing the risk of falling. If prescribed, it is important that individuals actually take their vitamin D and calcium supplements and their osteoporosis medication to improve their bone health and therefore reduce their risk of serious harm should they fall.
Take the opportunity of a medication review to check both whether the patient is on a medication which may have caused or contributed to a fall and whether the person could be or should be on bone strengthening medication.
Orthostatic or postural hypotension. Sometimes, when an older person sits up in bed or stands up too quickly, their blood pressure can drop suddenly. This can cause dizziness, blackouts, or make the person unsteady when walking. Encourage the person to sit up slowly, move their legs and feet before standing, or count to 10 before they start to walk. Report palpitations, dizziness or blackouts to the person's GP. Checking for orthostatic or postural hypotension by trained staff or the district nurse.
Right, Agnes, if you let me get your arm, I'm going to do your blood pressure.
Ask the person to lie in their bed for 5 minutes and take their blood pressure while still lying down.
Going to start, and remember it'll get tight round your arm. Yeah.
Then ask the person to sit up or stand. Take their blood pressure immediately, then again when they've been standing for 3 minutes. You may notice a drop in their blood pressure. Alert the person's GP if the systolic drop is greater than 20 millimetres of mercury and the diastolic drop greater than 10 millimetres of mercury.
Daily living tasks.
Morning, Beth.
A number of people living in a care home will require help with daily tasks such as washing, dressing, getting in and out of a chair or bed, toileting and bathing. Some may have difficulty with walking, turning, standing up or transferring. Ensure that the person's chair is suitable, that their bed is at a suitable height and that you agree with them when assistance is required. Hire toilet seats or grab rails if required and space to manoeuvre hoisting equipment. It is important to have the right equipment to assist. Some people will have cognitive impairment. This may include having difficulty with short-term memory, problem solving, understanding, communication, orientation, concentration.
People living with a dementia are at increased risk of falling. As their mobility decreases, their ability to recognise, judge and avoid hazards decreases.
Check there are clear signs, which may include pictures, to bedroom, toilet and shared areas. Use physical gestures or prompts to help with communication. Ensure that a person's environment is free from hazards. Sometimes telecare or assistive technology equipment, such as bed and chair occupancy sensors and pressure mats, can alert a member of staff when a person might need urgent help.
Are you okay? I'm okay, darling, yes. Are you sound fine?
I am.
Oh, that's lovely.
Individuals with sight loss will be more at risk of falling. Most people take the opportunity of having their eyesight checked once a year. It's important that they have their vision and eye health checked. Macular degeneration, glaucoma, cataracts and diabetes can all affect a person's vision. Bifocals or varifocals can be difficult to get used to and can change the person's perception of the ground. Some people might need help to keep their glasses clean or prompting to wear them. Check that there is good lighting day and night. Hearing and vision are important for maintaining balance. People may need to be referred for a hearing test. Check hearing aids are in working order.
The blue one goes in there and the red one goes in there.
Some people may require help to fit their hearing aid.
Foot care.
If a person has foot pain or discomfort, they may have difficulty with walking, balance or stability. Any painful corns or calluses should be referred to the podiatrist.
Nails should be filed weekly before a bath or when dry. Take care to file nails level with the end of the toe, no shorter. File thicker nails in length and thickness. Disposable or metal files can be used. It's important to wash and dry well between the toes during the bath or shower. Skin becomes dry with age, especially around the heels. A moisturiser should be applied daily but not between the toes. Footwear. The more mobile a person is, the more important it is to have supportive footwear. Shoes should be worn where possible. They should have a lace or strap to secure the foot when walking. Adequate width and depth are required to prevent pressure on the toes. Slippers may be used for shorter periods when an individual is less mobile. Any painful corns or hard skin should be referred to the podiatrist.
People who need to go to the toilet frequently or with urgency, particularly overnight, or who have difficulty getting to the toilet, will be more at risk of a fall. A risk assessment of the person's toileting needs should be carried out. The person may need supervision or assistance. Consider a bedside commode, a light by the bed, and clear signs to the bathroom. If the person has an ensuite bathroom, keep the light on and the door open at night. The person may benefit from a regular toileting routine or a continence assessment. If there is a change in the person's routine, check for acute infection. You may wish to make a referral to the continence service. Falls in care homes often happen during the night, particularly when people are going to the toilet. Those at risk of falls may require closer supervision or assistance at night. Changes in mood can be linked to falls. A person may appear low in mood, depressed, anxious or fearful of falling. It may be that a lack of activity can lead to reduced mobility. Reassure the person and encourage socialisation and meaningful activity.
Roll out the barrel, we got the blues on the run. Sing, boom, ta-ra.
Environment. When an older person first moves into a care home, they are at more risk of having a fall within the first few months. The environment will be unfamiliar and they will require help to find their way around. Clear signs, including pictures, to their bedroom, bathroom and shared areas will help. Explain the importance of getting help and check the person is able to operate the call bell.
Want me to show you how to use this one?
Yeah.
We're using this one. When you press this once, it's when there's a red one.
Set everyday items within reach, for example glasses, shoes, a walking aid if used, and the call bell. Check the person has ready access to a drink and that they are encouraged or assisted with fluid intake, as dehydration can also be a falls risk. Risks relating to the surrounding environment include poor lighting, especially on stairs, low temperature, we don't function so well physically or mentally if we're cold, wet, slippery or uneven floor surfaces, clutter, chairs, toilets or beds being too high, too low or unstable, damaged or unsafe walking aids, poorly maintained wheelchairs, for example brakes not locking, loose-fitting footwear and clothing.
Osteoporosis. Osteoporosis is a condition commonly in older people when bones can become thinner and more likely to break. There are some things which make people more likely to develop osteoporosis. The following factors can increase a person's risk of osteoporosis: family history, age, being older, previous broken bones, smoking, high intake of alcohol, lack of physical activity, low body weight, some medical conditions such as rheumatoid arthritis, Crohn's or celiac disease, some medications such as corticosteroids. Osteoporosis risk must be considered in combination with fall risk. People living in care homes are at more risk of having a fracture. Calcium and vitamin D. We need to maintain healthy bones throughout our life, including in old age. Eating a well-balanced diet will help keep bones healthy. Calcium is important for keeping bones strong. Foods that contain calcium are milk, yogurt and cheese. Other foods are dark green vegetables such as cabbage and broccoli, also almonds, salmon and tinned sardines. The best source of vitamin D is sunlight. Getting about 20 minutes of sunlight 3 times a week during the summer is beneficial. As many people living in care homes are unable to get their vitamin D from sunlight, they are likely to be deficient and may require a calcium and vitamin D supplement. This calcium and vitamin D can help keep bones healthy and reduce falls. There are now a range of forms in which calcium and vitamin D can be prescribed. A well-balanced diet, including calcium, will help to keep bones healthy. Sunlight can help absorb vitamin D, which is also important. Most people living in a care home need a calcium and vitamin D supplement to keep bones healthy and reduce the risk of falls.
Osteoporosis medication.
If a person breaks a bone, they may have osteoporosis and require medication such as a bisphosphonate. This medication can help strengthen bones and reduce the risk of having a fracture. The most common medication is alendronic acid. This needs to be taken in a very controlled way for it to work. If the person has difficulty with the medication, you may wish to discuss alternative treatments with the person's GP or fracture liaison nurse.
If you're helping a person take a bisphosphonate, the person must take the medication once a week on the same day each week. It must be taken first thing in the morning before any food or drink other than tap water or any other medication. It must be taken with a full glass of tap water. The person must remain sitting or upright for half an hour, not lie down again. This prevents irritation of the gullet, or the esophagus.
service provision to a care home. Your care home should have written information which is held centrally on local services and how to refer to them. You may wish to refer to a service for support in aspects relating to falls and fracture prevention and management. Education and training.
You think of anything else that you might think someone fall over?
Staff training is important so that everyone in the care home team understands what factors can increase a person's risk of falling and what actions can reduce these risks. Falls prevention should be included in staff induction training and as part of continuing personal and career development so that staff feel confident and competent in promoting falls prevention.
The key messages are: falls are not an inevitable part of getting older. Each person living in a care home must have an individual assessment of their falls risks and action plan. After each fall, the risk assessment should be reviewed and a new plan written. Regular GP medication reviews are important. Look out for side effects of medication. Encourage a well-balanced diet, including calcium for healthy bones. Bone health medication can help strengthen bones and reduce the risk of having a fracture. Encourage safe physical activity and maximise quality of life. Ensure all staff in the team understand how they can help to prevent falls and fractures.
Falls prevention is everyone's business.
All these actions we've spoken about today require a team approach if falls and fractures are to be prevented.
Thank you.